Presentation is by Dr. Yash Parmar. He is present. Okay. He will be presenting on arrangement of ocular blood vessels in eyes with fundal coloboma.
Yeah. Good morning, everyone. I am Dr. Yash Parmar. I'll be presenting arrangement of ocular blood vessels in fundal coloboma. So, retinochoroidal coloboma occurs due to incomplete fusion of the embryonic fissure, and in that, hence, the outer retinal layers are absent, and the inner retinal layers continue as the intercalary membrane. The outer retinal layers can, or the photoreceptors can fold upon itself and are seen at the edge, called as locus minoris resistente. There are two classifications which we commonly use. This is the Edaman classification, where it has been classified into type 1 to 7, where type 1 is above the disc, type 2 is at the upper margin of the disc, type 3 is at the lower margin of the disc, type 4 is the disc coloboma, type 5 is isolated fundal coloboma inferior to the disc, type 6 is the pigmentary coloboma, and type 7 is the peripheral coloboma. The other classification which we commonly use is Lingam-Gopal classification, which has classified colobomas into 6 types, in which type 1 to 3 does not involve the disc, and type 3 to 6 involves the disc. However, that classification has not included disc coloboma as a separate entity. So there have been very few studies which have described arrangement of ocular blood vessels in fundal coloboma. One was by Casper and other was by Lingam-Gopal sir. But they described only the retinal blood vessels which were going through in the colobomatous area. They did not describe the choroidal blood vessels and the vortex vein in the extra colobomatous area. So we found this interesting finding in our clinic, and hence we went ahead with this paper. It was a retrospective observational cross-sectional study with 69 eyes of 45 patients. Ultra-wide field fundus photo, optos photos were available for all the patients. FFA and ICG was available for a limited number of these patients. So what we looked for is the origin of the retinal blood vessels from the disc, their course into the coloboma, whether retinal artery and vein were present inside the coloboma, extra colobomatous area, whether they had dilated tortuous choroidal vessels and vortex veins, and also this interesting finding of these dark vessels, which was initially thought to be choroidal vessels, but choroidal vasculature is not present in the coloboma, and these are episcleral vessels which are seen. This was shown by Lingam-Gopal paper also. So these are some examples. This patient has type 4 and type 7 coloboma, and we can see that the vessels are arising from the disc margin. There is this dilated vortex vein and choroidal vessels. There is the continuity of these retinal vessels in the coloboma is not traced, and we can see the dilated episcleral vessels on ICG. This is another example of type 1 coloboma. The disc is not distinguished very well, and we can see the dilated choroidal vessels. The course is not very good, and we can see these episcleral vessels. So 25 males and 20 females were included in the study. 24 eyes had bilateral coloboma. Mean age was 36 years with the age range of 6 to 76 years. Visual acuity range from 6.6 to counting finger half meter. A maximum of 3 coloboma was seen in one eye. 78 colobomas were included. 65 were retinochoroidal coloboma and 15 were optic disc coloboma. So this is the table depicting the various aspects. The overview is that the type 1, 2, 3 and 7, which are basically the large colobomas, did not have the vessels, the retinal vessels in these colobomas did not have a continuity with the vessels arising from the disc and also in the extra colobomatous area. They had lesser number of vortex veins and significant episcleral vessels seen in these choroidal colobomas. Whereas the small colobomas like 4, 5 and 6 had the normal number of vortex vein. The episcleral vessels were not that commonly seen, and the continuity of the retinal vessels inside the coloboma could be traced easily. So the previous knowledge is that there are very few studies in accordance with Lingam-Gopal et al. We found that retinal blood vessels can be seen in the choroidal coloboma in spite of the absence of RP. Hence the VEGF and vasculogenesis should not ideally be there, but we can find retinal blood vessels in the coloboma. Choroidal blood vessels are not seen, and these deep episcleral vessels are seen, which is confirmed on ICGA. Our interesting finding is that type 1, 2, 3 and 7 have prominent choroidal vessels. The continuity is poor in these types. The deep episcleral vessels are more commonly seen, and overall the vortex veins seen in these patients are lesser in number, probably because the choroidal vasculature is less, hence the drainage is lesser, hence they become atrophic or get collapsed. So the strengths of our study is one of the few studies, the sample size is better, and there is a better understanding of the vasculature in these studies, as in we've studied the choroidal vasculature and also the vortex vein. Limitations were that the FFA and ICG were not available for all patients. Axial length measurement was not done for all the patients. So in conclusion, coloboma eyes do have variation in the arrangement and distribution of ocular blood vessels. Position, size, anterior posterior extent are the primary determinants of these variation. Though this is a descriptive study, it will help in surgical planning and laser for these patients. But future studies with better ICG will help. These are my references. Thank you.
Thank you. That was a very nice presentation. And any questions?
Surgical management.
Yeah.
Now, in what way will it help the
So
surgical
sometimes in retinal detachment, there are taught ICM. So sometimes we have to give a relaxing retinotomy cuts on these ICM. So if we can trace the vessels well and see their origin, we'll tend not to cut it.